Next, we have Anil Hebbar from Mumbai, but of course he's been working all over India now. Anil has been working on COVID relief both in Maharashtra and decided to expand that work to Northeast. So he's been spending considerable amount of time in Northeastern states. Uh, so the work that Anil did, which was initiated with our support last year, which kind of scaled up to almost yeah, for providing food in the slums when the lockdown happened. And then it got scaled up by the local support. That was noticed this year by New York Times. And that's one of the ways in which aid was mentioned in the New York Times, because Anil had the presence of mind to say that aid had triggered the starting of this work. And aid has this year supported about $450,000 to Anil's work for meeting the second wave crisis in Mumbai as well as in rest of in northeast parts of India. So we'll hear from Anil on this work. Hi Anil, you're next.
Hi. The New York Times was a fortuitous thing which happened just because I sort of participated in the vaccine trials and became the poster boy of vaccination because I was willing to talk. And then I was interviewed by a whole lot of people, and that's how it happened. Anyways, like to thank AID for the support. They've been the backbone of support for Bombay Sarvodaya Friendship Center for more than two decades or more now. And during COVID, of course, we started off with the initial contribution of $10,000, which was sent for starting our ration relief work and also running a camp, 300 plus migrant workers camp at Warsaw along with the civil defense. And then it grew on. And in the second wave, we thought that we'll focus more on medical relief, healthcare related work. And the first project that we started was 101 bedded ICU complex at Vittalwadi, which is just about 60, 70 kilometers from Bombay. And then we moved to the Northeast to start our work. I would like to start the presentation. If you can put up the slides, I'll take you slide by slide.
Anil, can you spend 1 minute giving your background also that made it possible for you to do the work to help these hospitals?
Sure. So I come from a medical background. I have, in the year 2000, I started a company called Emergent Meditech, which was into healthcare. Of course, we are mostly into cardiology and cardiac surgery, introducing the latest technological advancements in these, like stents and implantable defibrillators, intravascular ultrasound, and a whole lot of things. So that gave me a bit of a background to take up COVID relief work in the domain of healthcare. And Assam, the Northeast has not been new to me. I have been going to the Northeast quite a few times. The first time was in 88, 89 when I cycled from Arunachal Pradesh, Itanagar to Oka in Gujarat, which was about 5,800 kilometers, along with Baba Amte, the social reformer. And since then, I've been associated with various things in the Northeast. So this time we thought that let's focus our attention in the Northeast because nothing much was being done there, and being hilly terrain, it was very difficult to access the remote population. So we decided to focus our efforts on the Northeast. And the first project came up in the end of May when an organization we've been working with, Shanti Sadhana Ashram, they wanted to have a 20-bedded COVID care center in their project at Guwahati. So I was not very keen on a 20-bedded center because it will get filled in a day, and then what do you do? So we asked them to give us a location to put up a larger project. So the first was we thought we'll put up a 140-bedded project. 20 beds would be funded by the World Bank Indian Employees Club, and 120 beds would be funded by BSFC. That's how we moved to Demaji, where they had an ashram there. But then when we saw the site, we felt that the number of toilets and all could be a problem. So we requested the district collector, Mr. Vijay Bhaskar Reddy, to give us a better venue. And he suggested the Demaji Engineering College, which was newly constructed but not open due to COVID. And that was the ideal location to start a center. So we first worked on putting up a 140-bedded COVID care center there. That is what aid had funded us for. And initially, when we requested aid for funds, it was for the 140-bedded center and 100-bedded hospital at Osmanabad, a COVID care hospital at Osmanabad, and another 101 beds at Vithalwadi. We finally did not go ahead with the Osmanabad project because we did not get the right type of support from the government, and there's no commitment to run it properly. So we decided to focus more on the Northeast itself. And Demaji gave us a request for 210 more beds. They wanted the project to be expanded from 140 beds to 350 beds, and we went ahead doing that. So that's the largest, probably, COVID care center in rural Assam, or maybe in India also, I'm not too sure. A massive 350-bedded COVID care center in Demaji district. And Demaji, for your information, is one of the remotest districts in India. Very, very backward in everything related to healthcare or whatever, because it's in the far easternmost part of the country and bordering Pasighat in Arunachal Pradesh, and a few kilometers later you'll get China. And in the entire district, there was not a single ultrasound machine which was working, even though about 17 deliveries take place every day in the district. So we also gave them an ultrasound machine. And I would request you to start the slide so that I'll take you one by one what we have done. So Bombay Sarvodaya Friendship Center, like most of you would be knowing, it started with work on watershed management. My colleagues Daniel Bhai and Michael Mazgaonkar and Anand Mazgaonkar have been at it for more than 3 decades now. It was started in 1982, and AID has been a supporter for more than 2 decades for this work. And slum amenities program is also something which AID has supported for the last 5 or 6 years, which my colleague Mr. Bilal Khan looks after. Food for Grains for Work program was also started in Gujarat by the Mazgaonkar brothers, and that's been carrying on very well. Education centers, we have started 3 education centers in the slums in Mumbai, and this has been progressing pretty satisfactorily. We have more than 1,000 children who have been attending these centers every day. Otherwise, they didn't have any facilities there in the slums, and they would have been victims to drug addiction and many other things. But they've been spending at least 3 to 4 hours in our centers every day, and it's benefited them a lot. And then COVID interventions and healthcare, which I'm going to talk about now. Yeah. Now, so this is the 350-bedded COVID hospital that we put up in Demaji. We had some very good exposure also we got when we did this, because 20 of those beds were paid for by the World Bank Employees Club in India. It was essentially for their own employees who are in Assam and the other states of the Northeast. So apart from that, the rest of it was funded by us. But then the Vice President of World Bank International Finance Corporation, Mr. Monish Mahurkar, happened to come for the inauguration, and so it got a lot of attention from the media and from the government. So we had the Health Minister of Assam, Mr. Keshav Mahanta, who inaugurated the project, and the Member of Parliament from Demaji, who also graced the occasion. And this was a very, very successful project. And from day one itself, we had more than 70 patients who joined, because they had some small centers in different parts of the district, and it was very inaccessible. Whereas this place is more accessible, and ambulances can bring patients very soon. And the government also changed the rule that whoever was COVID positive should come to one of these centers. Otherwise, they would spread the disease in the villages by not adhering to good practices. So it was occupied pretty much from day one. And that's why they wanted us to expand it from 140 beds to 350 beds. So this was this photograph was taken on the day of the inauguration, which happened on August 24th. Apart from the COVID care center, we made a detailed survey of the entire health infrastructure in Demaji district. What we found was that more than 70% of the district is populated by tribals, the Adivasis, and there was a lot of vaccine hesitancy in these areas. So one of the things that the collector requested us was for these vans. There's a small mistake here. It says 5 COVID dengue awareness vans in 5 districts of Assam. It is not 5 districts; it is in 5 blocks of Dhemaji district. Sorry for the mistake. So these are the 5 blocks that we had visited: um, Dhemaji, Jonai, Gogamukh, Sasaigaon, and Shilapathar. So these blocks of the district, we had 5 vans like these, which went around and um, uh, spreading the need for vaccines. And in certain cases, they also would carry boxes of vaccine in those cold boxes, and then give the vaccines in the villages with the health workers in these vans. So this was pretty successful, and it went on for 2 months. We had 5 of these vans in each of the blocks, which every day for 2 months it would go around announcing. One of the bigger threats than COVID we found during our visits was dengue. A lot of children were dying out of dengue. In fact, on the first day we went, we heard that 4 small children had died because of dengue in one of the blocks. And so we also printed colorful pamphlets on how to control mosquitoes, breeding of mosquitoes, and how to tackle dengue. So these vans were sort of multi-purpose. They handled COVID and dengue both. Here you see the health minister and the member of parliament flagging off. Mr. Mahurkar has also seen the first van that we flagged off. The next slide, please. The other major problem there was that the ASHA workers were not trained at all. They didn't have any equipment with them to do anything meaningful. They would just ask them to go to the district hospital. For everything, the only solution was district hospital, which was very badly equipped, and there was nothing there. So the tribal population had to go to the neighboring districts of Dibrugarh or Jorhat. And you can imagine what happens if a tribal patient goes to another district. It's impossible to get any type of treatment. So we thought that the best thing was to empower the ASHA workers first. So there are totally 746 or so ASHA workers in the whole district. So we had a train the trainers program for them. We had experts who came in from Mumbai and trained 20 of the trainers, because one of the major difficulties is that the ASHA workers know only Assamese. Most of them are women from the villages, and even Hindi is not good. So there was this communication issue. So we decided that first we'll have a train the trainers program, and we trained 20 good ones among them as trainers, and they would then train the others first in the presence of our nurses, and then later they would carry it on their own. So we had a very successful 2-day train the trainers program, and we also came up with these kits for ASHA workers, where we had a pulse oximeter, a temperature gun, infrared temperature gun. Then there would be a glucometer. There would be a BP measuring equipment and a stethoscope, along with a few basic medicines like ORS and antibiotics and paracetamol and things like that, which they would need in their day-to-day work. So this was a big boost for them, because they had nothing before to treat patients with, and they just would ask them to go to the district hospital. But now they could initial things could be taken care of in the district itself. And the second thing also was that this gives an opportunity for them to earn a little bit money, because see, the patient would spend a lot of money to go to the district hospital and then get the test done there or in the private. Whereas here, if somebody does a sugar check for 10 rupees or a BP for 10 rupees, the ASHA workers also would be incentivized to do work. Otherwise, their salaries are very, very low, and there's no incentive for them to work. But
Anil, let me just add that ASHA workers are the village level workers from the employed by the government, supported by the government.
ASHA workers are the bottom of the pyramid. They are all hired from the village. Every village has a ASHA worker, and in Assam there are like in every state there could be, depending on the size of the state, 40,000 to 60,000 ASHA workers. The bigger states have about 60,000, and smaller states have lesser. So in the Dhemaji, for example, there are 746 of them. So they were the ones who have been trained. The next slide, please. Yeah. So I told you that every day there are 17 childbirths in Dhemaji district, and also a lot of other complications. So there was no ultrasound machine. So the maternal mortality rate is highest in Assam among all the states in India. So one of the targets we took was to reduce the maternal mortality rate and also help other patients who need surgeries like appendicitis and things like that. So this is the machine that we have given to them, costing about 20 lakh rupees, and it's really helped. Every day there are tens of ultrasound which is conducted. The next slide, please. Yeah. And in Maharashtra, I told you about the 101 bed hospital at Vithalwadi. This is a high dependency unit which has been put up at Vithalwadi to take care of any future waves of COVID. Apart from the equipment which we supplied, this was partly like about 1 crore of rupees we have spent from the funds sent to us by BSFC, and we needed almost 3 crores plus for this project. We also got the support from Give India for about 1.15 crore. And also they gave us an oxygen plant costing 1 crore of rupees. So we could complete this project with the money that we had. So there is a 666 liters per minute oxygen plant, which has also been set up here. And you can see all the oxygen pipelines which have come in and the equipment going in. This hospital is actually fully ready now, and it's going to be inaugurated well in time for the Omicron wave that everybody is expecting. And the first Omicron case in Maharashtra was in this place, Kalyan Dombivli Municipal Corporation, where we have this hospital. The next slide, please. This is a 101-bedded hospital with a few dialysis stations also and a mobile X-ray. It's a very high-end facility which has been put up. And along with this, since we didn't do the Osmanabad project, there are two other projects we took up. One is at Anjanvel in Konkan, where Yusuf Merli Center runs a hospital, which the government converted to be a 20-bedded COVID care facility. And the other one that we are now doing is in Nanded district at Kinvat, where we'll be supplying equipment to put up a small ICU in Sane Guruji Rugnalay in Kinvat, which is again a 95% tribal district. 95% of the population there are tribals. The next slide, please. So the Kalyan Dombivli Municipal Corporation had a function to sort of recognize the work we have done there, and I was on behalf of all our supporters, I was recognized in a small function they had on their foundation day. We had received a total of $450,000 from aid, and we had requested aid to give us before June 30th because we're not sure when our FCRA would be renewed and all those procedures. It's still not happened. It's there. Our application is there in Delhi, and they've told us that there's a 2-month delay in because of the huge rush there is for processing the applications. And so we had requested for the entire money for our plans for the whole year to come in before June 30th, and that's how we had got $450,000 then. Out of which more than half has been spent now, and about $180,000 are still with us. But we have a lot more programs which we have planned. Like there are 29 PHCs in Dhemaji district. We want to upgrade all the PHCs so that everybody does not have to come to the district hospital. They can be treated at the PHCs itself. So we have a revamping program for the PHCs. About 14 of the labor rooms in district hospital in the PHCs are being revamped. Many of the pathology labs also in the PHCs are being revamped with the funds that BSFC has given us. The remaining funds that we have would be used between now and March when we have planned all these things. So that's in short for what we have done. Apart from this, we have also done some other things like based on the request that we have got from different chapters of aid. But I have not mentioned it here because we have done it from other funds we had raised and not from the money we got from aid. For example, in Kashmir, we gave about medicines and ration kits worth about 2 million rupees for a group in Kashmir. And there is Beba Collective to whom we gave ration kits. And we also gave oxygen cylinders, about 60 of them to Mahendragarh district in Haryana, based on one of the aid chapters requests. So these are all some of the other things that we have done on healthcare. And I'm not touching any of our other work like livelihood programs and things like that, which have been going on with some other fundraising. We have been active on the crowdfunding sites also. So we could raise some money there. So we've done a lot of livelihood projects also this year. Yeah.
Thank you so much, Anil, for that, for that wonderful presentation. And It's I also just want to give a little bit of context before we move on to the next speaker. Is that like I think one of the opportunities, or I shouldn't say opportunities, or one of the needs that we have been trying to meet here has been to support infrastructure in government facilities. This is not something that aid has done in the past, so it's been new area both for groups like Anil in India to work on and for aid to support. But during this COVID crisis, it became clear that some intervention from the NGO sector or working with the government to step up its infrastructure in villages or in remote districts would be of help. And on an experimental kind of a basis, aid and Anil and several other groups have got involved in these kind of efforts. So Anil is closely monitoring how this equipment that we have sent to various places will be used. But this kind of involvement in infrastructure has been a new direction for aid. I can